Tsetse flies, vectors of sleeping sickness. Tsetse flies, found primarily in rural sub-Saharan Africa, are infamous for their role in transmitting African trypanosomiasis, commonly known as sleeping sickness. Responsible for approximately 10,000 deaths annually, these insects pose a significant threat to human health and economic stability in affected regions. What are tsetse flies? Tsetse flies are blood-feeding insects belonging to the genus Glossina. They thrive in warm, humid environments, particularly in savannas, forests, and riverine areas. These flies are medium-sized, with a distinct proboscis used to pierce the skin of their host and feed on blood. While they resemble common houseflies, tsetse flies are unique in their ability to transmit Trypanosoma brucei, the parasite responsible for sleeping sickness. Sleeping sickness, a deadly disease. Sleeping sickness is caused by two subspecies of the Trypanosoma brucei parasite, Trypanosoma brucei gambiense, found in West and Central Africa. It causes a chronic form of the disease, with symptoms appearing months or even years after infection. Trypanosoma brucei rhodesiense, found in East and Southern Africa, it causes an acute form of the disease, with rapid onset and severe symptoms. The disease progresses in two stages. 1. Early stage. The parasite multiplies in the blood and lymphatic system, causing symptoms like fever, headaches, joint pain, and swollen lymph nodes. 2. Late stage. The parasite crosses the blood-brain barrier, affecting the central nervous system. This leads to neurological symptoms, including confusion, behavioral changes, sleep disturbances, hence the name sleeping sickness, and ultimately, coma or death if untreated. Sleeping sickness is fatal without treatment, and even with proper care, the drugs used to treat the disease can have severe side effects. Impact on rural communities. The tsetse fly's impact extends beyond health to affect agriculture, economy, and social stability in rural sub-Saharan Africa. Many communities rely on livestock for their livelihoods, but tsetse flies also transmit a similar parasite causing nagana, a disease in animals. Nagana reduces livestock productivity, causing weight loss, infertility, and death, which in turn threatens food security and economic stability. Human populations living in tsetse fly-infested areas are often impoverished, lacking access to healthcare and resources for prevention or treatment. This perpetuates a cycle of disease and poverty, making sleeping sickness not only a medical issue but also a socio-economic challenge. Efforts to combat tsetse flies and sleeping sickness. Addressing the problem of tsetse flies and sleeping sickness requires a comprehensive approach involving prevention, treatment, and vector control. 1. Surveillance and diagnosis. Regular screening in at-risk populations helps detect cases early, preventing progression to the severe stages. 2. Treatment. Newer drugs, such as fexonidazole, offer hope as effective oral treatments with fewer side effects compared to older therapies like melarsoprol, which is highly toxic. 3. Vector control. Strategies to control tsetse fly populations include insecticide spraying, treating livestock or vegetation to reduce fly populations. Fly traps, blue and black traps, often baited with attractants, are placed in affected areas to capture flies. Sterile insect technique, SIT, releasing sterilized male tsetse flies into the environment to reduce reproduction rates. 4. Education and awareness, informing communities about protective measures, such as wearing long-sleeved clothing and avoiding tsetse-infested areas during peak fly activity. Progress and challenges. Significant progress has been made in reducing the burden of sleeping sickness. According to the World Health Organization, WHO, cases have declined substantially over the past few decades due to improved surveillance and control measures. However, challenges remain. Climate change. Shifting weather patterns may alter the distribution of tsetse flies, expanding their range. Limited resources. Many affected regions lack the infrastructure and funding needed for comprehensive disease control. Resistance. Overuse of insecticides could lead to resistance in tsetse fly populations, reducing the effectiveness of control measures. Tsetse flies and the disease they spread continue to pose a significant threat to rural populations in sub-Saharan Africa. While progress has been made in controlling sleeping sickness, ongoing efforts are needed to address the broader challenges posed by these deadly insects. By investing in healthcare, education, and sustainable vector control strategies, it is possible to reduce the devastating impact of Tsetse flies and improve the quality of life for millions of people living in affected regions.